I'm Dr. Rabin Rahmani, board-certified gastroenterologist and Director of Medical Education and Research in the Division of Gastroenterology at Maimonides Medical Center. I went to medical school at Albert Einstein College of Medicine in Bronx, New York. Graduated in 2005. After that, I stayed there to do my medical residency, also at Albert Einstein College of Medicine and Jacobi Medical Center. I followed that with a fellowship in gastroenterology at Maimonides Medical Center, which also involved a sub-fellowship at Mount Sinai Medical Center, transplant hepatology. After that, I joined the faculty at Maimonides as Director of Medical Education and Research, teaching the fellows and the house staff both in terms of research, GI diseases, and specializing a little bit more in advanced endoscopy, including ERCP and endoscopic ultrasound. Gastroenterology is, to me, a perfect mix of using your brain and your hands at the same time. It's very challenging when it comes to disease processes. There's a lot of different complex things that are involved as far as the GI system, all the way from the esophagus to the pancreas, stomach, colon. And at the same time, it affords us an opportunity to be able to do procedures which are, for the most part, minimally invasive, but at the same time very, very helpful to the patients, both in a short-term and long-term basis. Some of the more common things that we treat are heartburn, abdominal pain or stomach pains. Obviously, we're the specialist in screening colonoscopies, which is a common procedure and recommended procedure by essentially all the different medical societies at this point in time in 2013. A colonoscopy essentially uses a very small camera to look in the colon to see if there are small growths called polyps. Polyps are things that look like grapes at their beginning stages and sometimes are even smaller, but if they're left alone over a period of time could progress to become cancerous. If every single person who's supposed to have a colonoscopy would have a colonoscopy, there should be almost no new incidences of cancer, of colon cancer, of colorectal cancer found. And the reason for that is when we do the colonoscopy, when we do the test, we're able to find those polyps, remove them, and therefore prevent those polyps from progressing and becoming either more advanced polyps or cancerous. The procedure itself, believe it or not, only takes between 10 and 15 minutes. It's completely painless. It's done under what's called conscious sedation, which means the patient should be sleeping for the duration of the procedure. It's the same day for the procedure for the most part. Again, it varies a little bit depending on the other medical conditions that a patient may have. But for the most part, more than 90% of patients come to the colonoscopy and go home the same day. We have amazing technology now called video capsule endoscopy, which essentially is where a patient would swallow a capsule the size of a Tylenol, a little bit bigger than a Tylenol capsule perhaps, which has a camera inside of it. And when the patient swallows it, this little caplet actually sends images to my computer screen so that I could evaluate the entire small bowel to see if there's anything that may be causing problems such as anemia, nausea, vomiting, and so on. One thing that we're very involved with in the research department was research that pertains to probiotics, which are essentially good bacteria which may be very useful for many different problems that one may encounter in the GI system. And that was really very well received, and I'm very proud of that because it's something that is kind of natural, if you will. It's not necessarily medicine the way you think about it, or even procedure-oriented, but still has a lot of potential in terms of being able to help people. A lot of times patients are somewhat distressed by the fact that they have to see multiple different specialists for what they perceive to be the same problem. And one of the things that I'm proud of is that I'm able to provide, for the most part, anything that's needed as far as both medically for both GI and liver disease, as well as advanced endoscopy, and really follow those patients through myself as their physician, obviously in collaboration with other physicians as needed, their primary care doctor, oncologists, radiologists, pathologists, and surgeons. But again, when it comes to the GI aspect of it, for the most part, it's something that they know. If you need to talk to your gastroenterologist, you call Dr. Rahmani. I like to treat the entire body. I try not to focus so much on the GI system, at least as my first impression. I think a lot of things that have manifestations in the GI system really may be secondary to things that are going on in other parts of the patient's life. For example, stress. For example, neuropsychiatric things that may have its manifestations in terms of abdominal pain or other common GI symptoms. So what I try to do is really get to know my patients on a personal level. Even though as a specialist that may be rare, I find that really helps me a lot in terms of being able to connect with my patients and being able to treat them the right way.